Hi, my name is Brian Warden. I'm a Stanford-trained ear, nose, and throat specialist. I've been in practice for 15 years, and I'm here to share some additional useful insights about tinnitus. Now, the topic of conversation today is brain scans. A lot of patients that come to my clinic with the complaint of tinnitus are worried that they may have a brain tumor, and they oftentimes will request a CT scan or an MRI scan to further assess that concern. But is it really in a person's best interest in the setting of tinnitus to have a brain scan? Now, the tumor that most people are concerned about in the setting of tinnitus is something called an acoustic neuroma. Now, these tumors are rare. They are benign tumors that start from the cells that line the hearing and balance nerve inside the skull, in between the brain and the inner ear. And a lot of people that learn about tinnitus by researching on the internet will discover the topic of acoustic neuromas and learn that people that have acoustic neuromas oftentimes will report tinnitus. Now, although it's true that most people that have an acoustic neuroma report having tinnitus, is the opposite true? If you have tinnitus, what is the likelihood that you actually have an acoustic neuroma? Now, that is a question that's been evaluated by several different research groups over the course of the years. My favorite study was a study that was published by a group of scientists and researchers from Duke University in 2015. And they examined the charts of 281 patients over a 6-year period that had an MRI scan in the setting of tinnitus. And what they observed is that of those 281 patients, only 6 of them turned out to have acoustic neuromas. And all 6 of those patients also had a significant asymmetry to their hearing loss, meaning that their hearing was much worse on the side of their tumor than the hearing on the other side. And in most cases, the tinnitus was also asymmetric. So the tinnitus was much louder on the side that they had the tumor. Of the 275 remaining patients that had tinnitus in the setting of relatively symmetric hearing, none of them had an acoustic neuroma. Now, some of my patients will still say, even though the likelihood is low that I have a tumor, can I still have a scan just to make sure? Is there really any harm in that? And in truth, there is harm, and that is a clinical question that also has been studied extensively by a number of different research groups. And the conclusion is that it's actually not in your best interest to have a scan unless it's really clinically indicated. And this is true for a couple of reasons. First of all, the scans themselves have some risk associated with them. CT scans, for instance, are associated with a dose of radiation, and we have to be thoughtful about our radiation exposure because a person's cumulative exposure to radiation over the course of their life can increase the risk of certain cancers. In addition, many scans are also administered with a contrast agent, which is an agent that's inserted into the bloodstream through an intravenous line that helps make the pictures look better. But these contrast agents also have some risk associated with them. There's a small risk of allergic reactions, and occasionally these contrast materials can injure the kidneys or cause some other problems in the body. And finally, and this is probably the most important topic, most of the time when somebody has a scan, the radiologist will observe some other abnormality on the scan. And oftentimes this is a very trivial or minor abnormality. And we dub these abnormalities incidental omas, meaning that they're just incidental observations. But these incidental observations of minor anomalies oftentimes lead a patient down a path of having more scans, more doctor's visits, and oftentimes procedures, all of which have some cost and risk associated with them. And for most of these incidental omas, the abnormalities are minor and they never would have caused somebody any harm in their life. So, the take-home point is this. For the vast majority of people that have typical nonpulsatile tinnitus in the setting of symmetric hearing, it's not in your best interest to have a brain scan. The risks actually outweigh the benefits. Now let me clarify that term, nonpulsatile. So most people that have tinnitus have a perception of a sound that's like a hiss or a tone or a buzz that's rather constant. But somebody that has pulsatile tinnitus will report that the sound fluctuates. So it could be, for instance, a clicking or a tapping, or in some cases like the sound of their heartbeat or blood flow. Now, there are several circumstances in which a person with tinnitus should consider having a brain scan, okay? And let's go through those circumstances one by one. First of all, if a person has tinnitus just in one ear, then that's something that should be evaluated by a specialist, an ear, nose, and throat specialist, preferably an otologist, neuro-otologist, and there should be at least consideration of having an imaging study in that circumstance. Somebody that has tinnitus that is a whooshing pulsatile tinnitus, like the sound of heartbeat or blood flow, like whoosh, 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 in that sort of fashion, should be evaluated by a knowledgeable specialist, and consideration should be given to having a scan. Somebody that has tinnitus in the setting of a significantly asymmetric hearing loss. So if you have tinnitus but your hearing is much worse on one side than the other, then that's something that we should consider having a scan. Somebody that has tinnitus in the setting of a sudden sensory neural hearing loss. So sudden sensory neural hearing loss is a condition in which somebody all of a sudden, over the course of several hours or a couple of days, will lose a significant amount of their hearing. So if you have a sudden sensory neural hearing loss that's documented on a hearing test, then that tinnitus should also be evaluated with an imaging study. And the last situation is somebody that has tinnitus in the setting of other unexplained neurologic symptoms. So if somebody has new tinnitus in the setting of very bad headaches, or new tinnitus in the setting of other deficits like new numbness or weakness in their body, or tinnitus in the setting of some vision changes or something like that, should also be evaluated by a specialist, and imaging should be considered. But again, for the vast majority of people that have non-pulsatile tinnitus in the setting of symmetric hearing, a brain scan is actually not in your best interest. So if you have questions or comments, please leave them below. I hope that you found this content to be useful. If you're watching this video on YouTube, please like and subscribe. And if you're watching this video on Facebook, please like and follow us. I'm interested in hearing any of your comments and questions. And if you have suggestions for other topics that I can discuss in future videos, please let me know. I hope you have a good day. Thanks.